So you're missing some teeth? Have you ever thought about dental implants? Let's talk about it. Hi, my name is Jeffrey Butts and I'm a doctor of dental surgery, and this channel is all about health and wellness for you to be healthy and wealthy, all right? So today we're doing more teeth talk, all right? And we're talking about the power of dental implants. Now, that is one of the things that I specialize in. I love doing dental implants because it's such a major transformation for the patient from having a space. I think some people call it the side tooth. I got a good friend that calls it his old man hole, but we'll fill that in with putting an implant in the bones and the gum where the space is, and then eventually we come and put a tooth on it. No one will ever know. Never comes out. That's what an implant is, okay? Now, what I like about dental implants is that they are more predictable and sound than most dental procedures. The only thing that is probably a con about them or not so good about them is that it does take a little time. There is a surgical component that comes with it, meaning I have to drill something, I have to do something for you in order to put the implant in. And then there is a time factor. The time factor is just your body, the bone of your body where I place the implant in. The bone has to get rid of the old bone and grow new bone around the threads of the implant. And that is called osteointegration, bone osteointegration. Everything becomes one, integrated. So that is dental implants right there. That is it in a nutshell, right? So some people need some people need all of their teeth done, meaning they don't have any teeth, or I have to take all of their teeth because they're not viable or healthy anymore, or healthy in a way that I can even fix them. Or there's not enough teeth to fix to say, let's fix this tooth and do something around these teeth. Sometimes if you have less than 5 teeth that are good in either the upper or the lower, really there's no use in trying to fix those. Now we're talking about something that comes in and out, which is called a denture, or something that stays in or hooks in better than a denture, which is an implant retained denture. But those teeth are beautiful. It has gum simulation as well as the teeth, and honestly, no one would ever know that you don't have your real teeth. They would just think they have a beautiful smile. So that is of the things that I do with my team at Camp Creek Dental here. Okay, that's just part of it. But let's talk about why someone would get one. Well, first reason is just a boost of confidence. Now, if I had my eyebrow shaved off, right, and I was missing a tooth right here, you probably wouldn't see or notice that my eyebrow was missing, because you'd be like, you're missing a tooth. You're missing a tooth, but you'd miss the eyebrow, okay? That's how important teeth are. We identify people by how their smile is. That is just what the world does. So I'm proud to be part of a team that restores smiles and gets smiles back. Now, there are some people that will get crowns and veneers, and those are great. Those are basically, they shave your natural tooth down and they put a material. It could be porcelain. It could be this material called Emax, which is also called lithium disilicate. And they put that over the shaved portion, and that's your new teeth. And they look amazing, okay? Now, sometimes they can be too big and they look a little bit like horse teeth. I'm sure that you've seen that. You could look at somebody and be like, you have all new teeth, sometimes, right? And sometimes you can't even tell. They're so natural looking that the person just has beautiful teeth, right? But those veneers, crowns, it depends. Now, some people are like, I want to get my whole mouth did. Some people say that, and yes, I did say get my mouth did, yes, just like getting your hair did, yes, okay? And that's okay, but we're not gonna, me, myself, we don't just jump into that immediately. I would prefer, instead of cutting on the tooth and bonding a material on there that looks nice, I'd prefer to use your natural teeth in as natural a state as possible and either get them straighter or bond less than all of your teeth, only because Once you put a burr to a tooth, you actually start diminishing the life of that tooth because the tooth is a tissue and you're cutting into that tissue. And although you're bonding something that will last, it usually doesn't last forever. And you have to have a lifestyle that makes it so that should you choose to get something like that, veneers, crowns, or complete bonding on all of your teeth, you just have to live a good life, okay? And you have to eat more carefully because they can come off in the most inopportune times. That's just veneers, that's just what it is. Ask anyone that's had some veneers, they usually have to get them done over again. So if you're thinking about just getting veneers, just know that that's a lifetime commitment to always fixing and refixing that particular tooth or teeth that you said you wanted to get a veneer on. Now, I do them in extreme circumstances, but I try to dissuade people from getting them based on what they present with. So let me help you make a decision. I'll be a judge of whether we should do that or not. But we try to take care of all of our patients, and if it's something that someone really, really desires, and it's not necessarily what I agree with, we will definitely try to get you what you want, okay? But we will have talk. You will know all of your options, okay? So options is great, and that we have options is actually the most great, okay? So when you are missing a tooth, a front tooth, a side tooth, old man whole side, okay, it can mess with your confidence, right? So in messing with your confidence, knowing that people can see you when you smile, and why wouldn't you want to have a great big smile, okay? Your confidence is what moves you from your moment right now into the next moment. So you do want to go into the next moment confidently. Now, you can forget that it happens, and that's fine also, and then that's fine, but then you might pass yourself in the mirror and you get reminded that you are missing a tooth and you should get that fixed. Well, we do that. I believe that because I do the surgical component as well as the prosthetic component, and let's talk about those two parts. The surgical component is putting the implant in the bone in a certain way, at a certain torque or tightness of the implant into the bone, and then we just wait. That particular procedure is the surgical component, right? And then about, say, 6 months, 4 to 6 months after that has been placed, multiple post-ops, just making sure that we're looking and seeing how everything's going and how the bone's growing. Then I put a tooth on it to make it look like I was never there, or there was never anything ever missing, all right? So that's it. So you have a surgical component, you have the prosthetic component, or the crown or the tooth that goes on the implant. Put them together, you have a tooth that you do have to maintain, you still have to manage it. You can't say I have a bionic tooth now and I don't have to do anything. I can stop brushing and flossing right now. No, do not do that. Please continue to brush and floss your teeth daily, twice a day, and that's floss and then brush. I said it incorrectly. Floss and then brush your teeth, particularly if you have implants. And if you choose to get implants, please know that you should get them professionally cleaned at least 4 times a year. That's once every 3 months. If we're doing math, 12, so the God's calendar, right? So, teeth have a purpose. Besides making you look great and putting you deep into society where people are able to say hello to you and smile and not talk about you, all right? It's wonderful. But what are they really for? Well, actually, they are the beginning of your digestion. It is where we get our nutrition trail or digestion trail started. So we have enzymes in our saliva when we're chewing. We want to chew food up as well as we can so that when it gets into our stomach, that there's enough holes and sides that the gastric juices can get to break down the food, all right? So when you chew properly, you chew it into small bites. Those small bites go down. The acid is then able to extract the nutrient that it needs and break down that which it doesn't need more easily because it has a smaller piece to work with. And that is what chewing does. Little start of digestion, little ending of digestion. And then once it gets into your small intestines, that's when it's really taking out all the nutrients that it needs in order for you to be fortified, strengthened by what you do, by what you choose to eat. Now, I have been saying this for some time, and there's a reason why I say this, particularly because I do implants, and I do actually so many of them, right? If you pay attention to what you eat, how you sleep, your exercise, that's the form, style of your exercise, your detoxification moments, which includes bowel movements, it includes sweating, fasting, okay? And then mental behavior, which is, this is going great. This is gonna be great. Or I love the Lord. I wanna be a vessel of the Lord. Or gratitude, a good attitude, some forgiveness. All of those things are in your focus of control. When you control those things to the highest level for yourself, you are also giving your body better immunity. And if you just received an implant, the reason why I've been screaming this from the top of the hill is because if you got an implant with me or with anybody else, you want to let it be so that your body heals. And when your body heals, that's all you want. That's really it. But it heals best when you pay attention to your health, which is your wealth, which is the only thing that's important at the end of the day. You cannot give your broken self to someone and expect to do a good job. You just can't, right? So when we take care of ourselves and we take care of our teeth, we take care of each other because we're able to. So once I started doing implants, I noticed that if I give my patients this small bit of information, which I think is really huge, then they can better take care of themselves out of my loving hands, right? So nutrition and teeth is just the beginning of your digestion. Sometimes when you're missing teeth, your speech is impaired, particularly the front teeth, if you're missing any front teeth. Or if you wear dentures, well, not that your teeth or your speech is impaired, but if you wear dentures, particularly on the top or the bottom, just dentures, they're partials, they come in and out, or complete dentures. You just have to basically retrain your tongue where to go so that you speak properly. But speech is also very important. I mean, the things that you want can be achieved by simply saying them. And saying them properly with the correct energy is how these things get to manifest. So, your speech, the power of your tongue, is something that you should not neglect. And you should make it so that when you say something, you mean it and you're able to back it up if it's a confident statement. Some people may consider confidence is cocky, but to me, cocky is someone that cannot back up the statement that they made, or they're bullying someone. And that's not too cool. But your speech, the way you speak, definitely can be improved with dental implants, and with missing teeth, it can be a problem. So the last thing I wanted to share with you guys about implants is really long-term oral health. Now, when you miss a teeth or a tooth, when you have had it extracted due to trauma, something hipped you, you fell, or it was decay, disease, it got so far that the tooth wasn't able to be saved, or you got a root canal and the root canal failed and now you need a new tooth because there's nothing else that can be done to a root canal, core buildup and crown prepped tooth. There's nothing else that can be done if that particular tooth is failing. Implants are the long-term solution. And when we're talking about a long-term solution, we're really talking about the benefits of the long-term solution. Now, implants, when you place implants in an extraction site or a site that's been extracted, what it does is it helps hold the bone in place. Now, imagine, if you will, there's a tooth that gets extracted. The bone part that it gets extracted from is called the alveolar ridge. It actually is on top of your mandible, is on top of your maxilla. It's just a bony area, it's slightly porous, and its only purpose in life is to hold the tooth in place. Now, imagine your purpose in life is to hold the tooth in place. That's what you do. You are now the alveolar ridge, and your tooth has been extracted for whatever reason, all right? Now, that part of the ridge no longer has its purpose because the tooth is gone. So what happens to the ridge, or the alveolar ridge, is that it atrophies and it shrinks, it shrivels up, it gets smaller, making your face smaller. When you put in dental implants, if you put them in at a proper time, past an extraction or at the same time as an extraction, it preserves that bone volume so that your face doesn't cave in, sink in. And that is just better for bone strength. Should something else hit your face, you have less likely of a chance of a fracture because your bone is sound by either placing an implant or just keeping your natural teeth, all right? So long-term health of dental implants is incredibly helpful. Over 10 years plus, those implants work so well. And I believe that implants placed by a general dentist that does implants a lot, as well as restores those implants, I believe, just because I'm on my own little island here at Camp Creek Dental, we pretty much do everything. I plan from the beginning to the end, and the way that I do that is I consider what the end looks like, and then I start. And I try to make it look just like the vision that I've said would be in the end, right? So that is dental implants in a nutshell. Those are some benefits and reasons for you to ponder if you're thinking about dental implants, if you're thinking about improving from having dentures or complete dentures, partial dentures or complete dentures. Yes, implants are way better. In some cases, the bone isn't sound. Sometimes we may have to, if you've been missing teeth for a while, that alveolar ridge has resorbed almost all the way. So there would have to be a pre-procedure to grow bone first, and then we'd be able to place dental implants. But I don't think anyone's hopeless. I think that if there's a will, there is absolutely a way. Some cases can be more challenging than others, and I have run into them. Sometimes I would just have to send it to a specialist, or the patient just wears a denture. It's possible that your case is very difficult, very challenging. It's very possible, but remember that all things are possible. So just because something's difficult doesn't mean that it's impossible. It just means that it's difficult. So don't give up on yourself. If you feel like dental implants is something that you want, you could do more investigation. You can come see us here at Camp Creek Dental, and we will talk to you about the real likelihood could be of you to get some dental implants, all right? Anyway, that is really what I wanted to share with you guys today. I did it. We're actually after work today. And of late, we've been recording in my home, but we just thought it'd be funky to actually do it at the office today. This is actually the beginning. We're bringing it back to the beginning. We are almost at 12,000 subscribers at time of this recording. I'm very happy that people have been tuning into the channel, which is really a health and wellness channel. From my perspective, this dental channel, this teeth talk guy, your dental friend, right? This is for you to make some more informed decisions and have some information for yourself, for you to be the best you can, so that you can give the best of yourself to whomever you feel needs it, right? And the channel actually got popular from when I started talking about blood type and blood type diets. So please check out those videos about blood types and blood type diets. Most people in the world are O, and if you see that video, see the multiple hundreds of thousands of people that have tuned in that were more than likely O's, and you get to see what we're talking about in that space. But I would also say, just like you know what your astrological sign is, what's your sign? Huh? What's your sign? Yeah, okay, good. So you know your sign, just like that, I need you to know what your blood type is, okay? And you get that together for yourself. Check out the other videos and you'll know why I want you to know about your blood type. And that's really all I got to say about that. Please like and subscribe. And please send this video if you find it helpful. Please send it to a friend, a loved one, okay? And we'll talk about a couple other things a little bit later. My name is Jeffrey Butts. I'm a doctor of dental surgery, with the thought in the back of my mind that pretty much nobody wants to go to the dentist. I try to make it as comfortable and as pleasant an atmosphere for someone to come into a dental office, all right? So when they enter the door, they're family already, off the top. I want them to feel safe. I want them to know that they are in an extra clean place. So clean. Not that you should eat off the floor, but I'd like you to think that you could. I notice that people do not just bring their teeth to me, they bring their whole bodies. So we review food, sleep, exercise, detoxification, and mindfulness behavior with the patient. We provide many services here at Camp Creek Dental. We do braces, root canals, and of course I do surgery. Wisdom teeth extraction, surgical extraction, simple extractions, and of course implants, single or full arch restorations should the patient need it. I have acquisition machines. They take digital images without putting a goop in your mouth in order to make an impression. I have a 3D scanner so I could take a better look at canals, I can look at bone, I can look at sinuses. I also do crowns, and I make the crowns here. So I basically have an in-house lab at the office that does lab quality crowns for the patients. We have big bays for our treatment rooms, and the chairs are just super comfortable. We usually have R&B, some hip hop playing. Music helps me move, particularly when some Jill Scott comes on, or some Marvin Gaye, or some Luther Vandross. Having been a rock star some time ago, I've gotten to play to 10 and 20,000 people at a time. I've been to Europe opening for the Black Eyed Peas. My best friend is this guy named Cody Chestnut. Music and dentistry to me are very, very similar. You have to train in order to play the instrument. You have to know the instrument itself, and then you have to also know the application of it. I'm definitely passionate. I'm caring, I'm empathetic. My staff is as caring as I am. I could not do anything that I do without my amazing team. If I was speaking directly to someone that was coming to see me, I would say, get ready for a good time, all right? Get ready for a dental experience like you've never had before, a positive one. Please be ready to accept the laughter and the music and the love that we have for everyone that we serve here.